think as you get older and you still want to be doing athletic things, then you need to modify your behavior so that you don't get injured. So I think there's, again, two main ways of getting hurt. One is repetitive injuries, and that would be somebody that's used to being a runner and they want to continue to run. They may have done marathons in the past. Maybe they're starting to have knee or hip or back issues and they need to cut back on the mileage. They can still be active. Maybe they incorporate riding an exercise bike or a bicycle on the road in place of some of the running. So impact activities, running being an impact activity. Change from tennis, playing singles to doubles, so that you're not running the court as much, but you're still able to play the sport that you enjoy. Golf, instead of walking the whole course, you may choose to use a cart. So you can continue to play the sport, you're just doing it in a modified way. And then the main thing, as I said earlier about the gym, is heavy is not good. And that's mostly an issue for my male patients.